Hi folks, Dr. Joel Hartl here, and today we're going to talk about strep throat. Strep throat is caused by a bacteria called group A strep. It's also called Strep pyogenes. If you'd like to learn more about what a bacteria is, please see the links provided with this video. There's over 100 different types of group A strep, and some of the different strains are associated with different clinical illnesses. Strep throat is by far the most common manifestation of strep pyogenes, but it can also cause a skin infection called impetigo, scarlet fever, eczema, lots of other things. You're generally considered contagious until you've been taking antibiotics for at least 24 hours, and we recommend that children not return to school or daycare until they've been taking the antibiotics for at least 24 hours and they are fever-free. Good old penicillin is the best treatment for group A strep. We generally use amoxicillin in children because it's more widely available and it tastes better. Group A strep is very susceptible to penicillin, and it dies very quickly. Most children are feeling better within 24 hours of starting the antibiotics. There has never been a recorded case of group A strep that is resistant to penicillin. So if it comes back, it usually means you were reinfected with a different strain or again. If you're allergic to penicillin, generally a cephalosporin will work quite as well. And if you're allergic to cephalosporins, there's still some options, but the resistance levels start to increase, so talk to your doctor. Group A strep is rarely dangerous these days. It did used to cause a lot worse infections, but since the advent of penicillin and the fact that group A is so susceptible to it, it rarely causes bad infections these days. The main concern now is an illness called rheumatic fever, where we miss the group A strep infection for more than 9 days, and then the immune system goes and takes care of the group A strep, but then it goes on to attack the heart and the skin and the joints, and it causes this really horrible condition called rheumatic fever that is difficult to treat. So that's the main concern these days. It's also the main reason why the antibiotic course is so long. So we have good data from a couple decades ago that shows that a long course of antibiotics will prevent rheumatic fever in almost all cases. There's no vaccine for group A strep yet. The best prevention is good hand hygiene, so washing your hands frequently, especially in school and in public areas and at home. A lot of people ask about taking tonsils out for recurrent strep infection. And we used to take a lot more tonsils out than we do these days because we've come to realize that there are some risks associated with taking tonsils out. And so the ENT surgeons have developed some criteria that we use before we even refer for a tonsillectomy. And those are the Paradise criteria. And it's 7 infections in 1 year, 5 per year for 2 years, or 3 per year for 3 years. Thanks for watching this short video about group A strep throat infection. I hope your child feels better soon, and give us a call if you have any questions or concerns.